What if I told you that one of the most commonly prescribed diabetic medications in the world may have more effects inside the body than simply lowering blood sugar? Some people who are taking metformin notice a reduction in their weight without necessarily trying to reduce it. Others report fewer cravings, better lab results, improved energy levels, and better hormonal balance. Researchers are now studying whether these medications could also influence aging, heart health, fatty liver disease, and more. But here is what makes this conversation very important. Many people take metformin every single day without fully understanding what it is actually doing inside their body beyond diabetes control. So in this video, I am going to break down the positive side effects of metformin in a clear, practical, and honest way, including the benefits that are strongly supported by science, the ones still being researched, and what you should realistically expect if you are taking this medication. And trust me, a few of these benefits surprise even experienced healthcare professionals. Let us get into it. Metformin is one of the oldest and most trusted medications used to manage type 2 diabetes. In fact, for many patients, it is usually the first medication doctors prescribe after diagnosis of diabetes. And there is a reason for that. It is affordable, effective, widely studied, and for most people relatively safe when used correctly. But over the years, researchers began noticing something interesting. Patients who take metformin often experience improvements in other areas of health that are not directly related to blood sugar alone. Now, before we continue, I want to make something very clear. This video is not encouraging people without diabetes to start taking metformin casually. Every medication has risks, side effects, and medical considerations. What we are discussing today are the additional health effects that researchers and clinicians observe in people already using metformin appropriately. Now, let us start with the most important benefits of all. Number one, better blood sugar control. At its core, metformin works by helping the body to manage glucose more efficiently. One of the main things it does is to reduce the amount of sugar your liver produces. Many people don't realize this, but the liver naturally releases glucose into the bloodstream, especially overnight and between meals. In people with type 2 diabetes, that process can become excessive and cause blood sugar levels to remain elevated even when someone hasn't eaten. Metformin helps to calm that process down. It also improves insulin sensitivity, meaning the body responds better to the insulin it already produces. Think of insulin like a key. In insulin resistance, the key stops working efficiently. Metformin helps the body listen to insulin again more effectively, which then allows glucose to move from bloodstream into the cells where it can actually be used for energy. And for many diabetic patients, this action of metformin leads to lower fasting blood sugar, improved HbA1c levels, fewer glucose spikes, and more stable energy throughout the day. That stability matters because uncontrolled blood sugar doesn't only affect diabetes in numbers, but over time, it can damage your blood vessels. It can also damage your nerves, kidneys, the eyes, and even your own heart. So, when metformin improves glucose control, it is not just helping numbers on a lab report, it is helping in reducing long-term complications as a result of diabetes. Another positive side effect of metformin is that it helps in weight loss or weight stability. One of the many reasons doctors appreciate metformin is that it usually does not cause a weight gain. That may sound simple, but it's actually important because several diabetic medications can increase body weight over time. Metformin tends to behave very differently. Some people remain weight stable, while others lose a modest amount of weight in a gradual way. Now, please note that this is not the dramatic weight loss people sometimes expect from viral social media discussions, okay? Metformin is not a magic fat-burning pill, but what makes it useful is the way it affects appetite, insulin levels, and metabolism. When metformin improves insulin resistance, the body becomes more efficient at handling energy. Some people also notice they feel satisfied sooner after meals. And if you are managing type 2 diabetes, but you are struggling with both diabetes and obesity, even moderate weight loss can significantly improve blood pressure, cholesterol, joint strain, sleep quality, and overall glucose control. What is important is that the weight changes associated with metformin tend to happen gradually and sustainably rather than rapidly. Number 3, on the positive side effects of metformin is that it reduces appetite and minimal cravings. This is one of the most commonly reported experiences amongst metformin users. Many people say they simply don't feel as hungry as before when they use metformin. Others notice fewer cravings for sugary foods or carbohydrates. Now, researchers are still studying exactly why this happens, but several mechanisms may be involved. Metformin appears to influence hunger signaling, insulin response, and how the digestive system processes nutrients. Amazing, right? For someone who is battling cravings constantly, this can help you to manage a healthy eating style more effectively. And that matters because cravings are often one of the biggest obstacles people face when trying to control diabetes or when they try to manage their weight. Some patients describe it this way: I finally feel full. That feeling of satisfaction can help to reduce overeating, emotional snacking, and constant grazing throughout the day. However, it is important to understand that appetite reduction varies from person to person. Not everyone experiences it to the same degree. Point number 4 on the positive side effects of metformin is that it improves heart health. This is where metformin becomes interesting. People with type 2 diabetes already have a high risk of heart attacks, strokes, blocked arteries, and cardiovascular disease. So, medications that improve both blood sugar and heart health in these patients are extremely valuable. Research has shown that metformin may help lower triglycerides, slightly reduce LDL cholesterol, improve blood vessel function, and reduce overall cardiovascular risks in certain patients with diabetes. Part of this benefit likely comes from metformin's function of improving insulin sensitivity and reducing inflammation in your body. When blood sugar remains consistently high, blood vessels become damaged over time. So, when glucose in your bloodstream is controlled effectively, it can reduce some of the stress on the cardiovascular system. Some studies even suggest that metformin users may experience lower rates of diabetes-related cardiovascular complications compared to certain other treatments. Now, this doesn't mean metformin replaces healthy habits. A medication cannot fully compensate for smoking, physical inactivity, chronic overeating, or uncontrolled blood pressure, okay? But when metformin is combined with lifestyle improvements, it can become part of a much broader strategy to protect your heart health. Point number 5 on the positive side effects of metformin is that it's a benefit for women with the polycystic ovary syndrome. Many people are surprised to learn that metformin is also commonly used in women with polycystic ovary syndrome, also known as PCOS. PCOS is strongly linked to insulin resistance. In many women, elevated insulin levels can disrupt hormones, which then contribute to irregular periods, weight gain, acne, fertility problems, and difficulty in ovulating. By improving insulin sensitivity, metformin may help to regulate some of these hormonal imbalances. Some women who use metformin experience the following: more regular menstrual cycles, improved ovulation, better metabolic health, and sometimes improved fertility. For certain patients, metformin becomes part of a comprehensive polycystic ovary syndrome management plan that also includes nutrition changes, exercise, stress management, and weight control. Again, it is not a cure for polycystic ovary syndrome, but it can be a very useful tool in the right clinical situation. But here is what makes metformin even more interesting. Everything we have discussed so far, blood sugar control, weight stability, reduced cravings, heart support, and hormonal balance, are only part of the bigger picture. Researchers are now investigating whether metformin could have effects far beyond traditional diabetes management, including possible roles in prediabetes prevention, healthy aging, fatty liver disease, and other long-term metabolic conditions. And honestly, some of the newer findings are surprising experienced healthcare professionals. So in the next video, we are going to dive deeper into the lesser known and more advanced benefits of metformin, including the areas where science is becoming extremely interesting right now. Trust me, you do not want to miss that discussion. It is over here, okay? Please watch it.